Hey, wellness family. This is Peter here, and I am today joined by, I don't want to say old friend because then we'll date each other, but this is a very dear friend of mine from college, from back in the day. I know her as Erin, but to you guys, she's Erin Stitzel Selover. And Erin is, I've known Erin from the days of coming from Jamaica with not having a car and borrowing her Acura Integra. Um, and just how cool she was about helping us kind of get off campus. It's not a surprise to me that you are in the world of psychotherapy because you always have this thing about helping people. So Erin, welcome, my girl. It's been years, man.
Thank you. I know it's so fun. I see you on your social media accounts, of course. So I feel like I have been connected to you in some way.
Uh-huh. Uh-huh.
This is awesome to actually speak with you, hear your voice, all that good stuff.
Yeah, yeah, it's very cool, man, especially in this pandemic times, you
I
know?
know. It's changed a lot
Yeah,
of things.
indeed, indeed, indeed. How has the pandemic dealt with you, and how have you and your family dealt with the pandemic?
It's a great question. I mean, it's still going.
Mhm.
I think the main thing I have found is how resilient and adaptive we are. I don't know if that's as a whole, but in our family, we have a 4-year-old daughter, Eloise.
Mm.
She just kind of kept on marching, right? She's so present. I find that little children are just in the moment. You have a daughter. How
Yeah.
old is she?
She's Miko is actually she's 5, going to be 6 in like 2 weeks, 2 or 3 weeks. Yeah, yeah.
So you know that at that
Mhm.
age, it's so easy to just be in whatever moment they are in. And I find
Yes.
they can just, keep moving. So,
Yeah.
but as far as work life and things like that, it luckily it's more acceptable now, even before the pandemic, for therapy to take place. Teletherapy was kind of already happening.
Yeah.
So that was a good transition, I think. But
Oh, okay. Very
yeah,
cool. So it's interesting that I mentioned before you are a licensed therapist, correct?
that's correct.
And when I saw that, I'm like, what? When did that happen?
Yeah,
So tell me a little bit about what drew you into the world of psychotherapy.
absolutely. Well, at college where we
Hmm.
were together, my degree was in sociology and anthropology,
Okay.
mainly because that just drew me in more than anything else at the time. I feel like when you're 18, you don't really know what
Yeah.
it's about.
I
It's
was
like,
such a dummy in college. I didn't know Jack.
what did you study? What was your degree in?
Oddly enough, I was a double major sociology and mass communication
Okay, see, well, see, you're in line,
in line.
just
Yeah.
like me.
Hmm.
There was something there, even at our young, tender age, right, that
Yeah.
we were drawn to. So, but I didn't go into it at all. After college, I just did a series of things that didn't mean anything, like sales, manager, all these different positions,
Mm.
until it was 2008, actually 2007, and I was in Chicago, and I had my first experience as a client with a therapist.
Oh.
And I just never would have considered going for whatever reason. And I was blown away by it, by how transformative it was. I worked with her for 9 months,
Hmm.
and I don't want to be dramatic, but it did kind of change my life.
Hmm.
It certainly helped with what I was struggling with at the time. The other part of that, though, I was like, I kind of think I want to do this. And she had kind of encouraged me, saying, I think you'd be great. So that's when I went to grad school. I started in 2008,
Hmm.
and I worked full time while I went. So it took me 4 years.
Mm.
I don't know if I would recommend that path, and then I was licensed in 2012 and have been practicing since.
Wow. The irony of listening to this, it's sort of like deja vu for me. It's like I'm looking into a mirror
Yes.
because for me, it was going through an experience where I had the near loss of my mother, then my sister passed away, and my marriage unraveled. And then I decided to go into therapy. And I wouldn't say it was a transformative experience, not like yours.
Yeah.
It was transformative in the sense that I remember not being able to find someone that looked like me as a
Yeah.
black male. And but at the same time, still pulling something away from the leader that I met. But I
Yeah.
often wondered if I could have had a better experience. I mean, she was helpful now, but I remember coming out of that saying, I want to be part of the solution. This thing is kind of cool. And we're at the end of the day, we're really philosophers, right? And we get to kind of philosophize about life, if you will. So
Yeah.
yeah, that's interesting.
Well, that's cool. And I think that's really important. I mean, to have everyone represented in other words, because sometimes it is true. I've had clients before who have asked, could I be referred to someone who is like more like me or looks more like me? I think that can be a very important part of a therapy relationship.
Right, right. And so, one of the big things why I brought you on today, and it's really a byproduct of emails that I've been getting, because I sort of post heavily on Instagram, do
Yeah.
my little YouTube thing here, which people are on right now, is that I've had emails about people who've dealt with trauma, and you have a background in dealing with people on trauma, and so that's sort of what the premise of this little discussion will be about. And so one of the things I sort of really wanted to ask you is, because we all think we have this definition of trauma. Now, what exactly is trauma from your viewpoint, and how exactly is it manifested in certain people?
Excellent question. And there's not one direct answer, I would say, because like many things in the diagnostic world, for example,
Mhm.
there's a continuum,
Right.
right? So it can manifest, trauma can manifest from something as small as, which would be considered trauma with a little t, it's kind of the industry talk. It could be as small as, I went to the dentist as a 6-year-old and I was terrified and I hated it and I cried the whole time, right?
Mhm.
Trauma with a big T could be, I'm a war vet and I, went through a traumatic war, seeing death and being a part of that. Abuse, witness to abuse, experiencing abuse, so again, something as small as a dentist appointment all the way through kind of the worst atrocities one can imagine. So, but really, it's the way I kind of view it is it's more the person's response to the event
Mhm.
that puts it in the trauma category. So we're talking about emotional reaction. We're talking about just the central nervous system and what happens there with the fight, flight, or freeze,
Mhm.
scenarios that take place. So in a way, it doesn't really matter what the traumatic event is. It's really more the response to that event. And I
I
think
see.
people get stuck in it. It's kind of like a wound, like a physical wound. And if debris keeps getting in that wound, it's not going
Mhm.
to heal.
All right.
Same thing with our brain or our minds. An open wound that hasn't been fully processed that keeps, either getting more debris by triggers.
Mhm.
I went to a dentist as a 6-year-old. It was awful. I have to go to the dentist every 6 months. Every time I go, I'm re-triggered,
Mhm.
kind of like the debris in the wound, and it can't heal. So it is a matter of trying to process memories that basically are stuck in our minds and in our bodies.
Oh, that's interesting. And so you said something a while ago. We all know about the fight flight response, right? But
Right.
you added in freeze in there. What
Yes.
does that mean in terms of trauma? It means that, if I'm guessing it, and if I was to sort of make a guess, are we saying that a
Yeah.
person gets stuck in the trauma, or is just a different way how they respond? Can you
Yeah.
elaborate on that some more?
Yeah, exactly that. Because exactly, if you are in a traumatic event and you have no option
Hmm.
to fight or to
Hmm.
flee, right,
Right,
from it,
right.
oftentimes just to survive it in the moment, we freeze, and that can manifest as what's known as dissociation, which I'm
Hmm.
sure you're
Right.
learning in your program, where we kind of, it's almost a spiritual way of describing it, leave our bodies
Mm,
temporarily
right.
because it's too horrific. You can't be there and, survive it. So the issue there though is when something like that happens, it can be possible that you then begin to do that throughout your life.
Hmm.
uh, the trauma is over, but if you have a trigger of the trauma,
Hmm.
boom, freeze, dissociate, I'm out of my body, I can't function.
I see, I
Yeah.
see.
Mhm.
So, what are some ways you've seen people manifest the trauma? I mean, I can tell in my case, I remember being homeless when I was 13 years old.
Right.
And in a lot of ways, I think I didn't realize how much it impacted me, where I would choose careers that made me, that in a weird way, it was sort of, let me get a job that makes me the most money without without really speaking to who I was as a person, because I was
Yeah,
terrified of going down that road again, right?
absolutely. Yeah.
So what are some of the ways that you've seen that trauma has manifested itself in some of your clients over the years?
Definitely that, what you just said, just kind of soullessly going through life and with an unconscious drive to do the opposite of whatever they experienced in the traumatic event. So
Mhm.
perfect example, you said, I just needed money. I
Yeah,
just needed money so I would never be homeless again.
yeah.
That's definitely, I see that. Definitely manifestation of addiction, eating disorders, things like that. If you think of trauma that is unresolved
Hmm.
as an overwhelmingly painful experience, then you're going to do everything you can to avoid that memory
Hmm.
or the flashbacks or the triggers. And oftentimes that's where addiction comes in, because it's just,
Ah,
I
I
need to
see.
numb out, I need to distract, I can't handle this pain.
Mm.
That's something. I've seen as severe as dissociative identity disorder as a result of complex and chronic childhood trauma, which
Right.
is just it's it used to be multiple personality disorder. It's been
Hmm.
updated
Right.
in the DSM, but it's the concept of, again, talk about dissociation. The trauma is so severe that in the moment, the mind splits and
Hmm.
creates a different person called an alter to just get through that moment. Or it's also connected to just I can't remember that, it's too extreme. And I have a client right now with that disorder, and
Hmm.
sometimes I'll talk to the person who's fronting most, and then I talk to alts in the session. So that's kind of a more extreme reaction to trauma, I would say. But anxiety,
Hmm.
depression, just your general things, but oftentimes you find as you dig, it's connected to an unresolved issue.
Unresolved issue. I see. I see. Now, I remember going into my program, I always thought about trauma as, when we're treating it, traditional talk therapy. Does traditional talk therapy work for, let's say you said little t trauma, let's talk about the big T trauma. Does traditional talk therapy work for either one? Or is it really an individual thing?
I think it's definitely individual. There are so many things that factor in,
Hmm.
even down to genetics. But I think yes. However, the difference is between something like talk therapy and, say, an EMDR type therapy is talk therapy is going to take a lot longer,
Mm. And,
basically.
does talk therapy for some people, and why does it take longer? Is it because the talk therapy consistently triggers the stimuli, what causes the traumatic experience?
It can be.
Um,
Yeah.
can be. Oh, okay, okay.
It,
And,
and where it depends on the individual of
mhm,
what they're able to walk through at any given time. What coping skills do they have in place that they
okay.
can walk through those difficult memories, basically.
Oh, okay, okay, okay. So you
Right.
talked about EMDR, right?
Mhm.
And you and I know what EMDR, what it stands for.
Yes.
But for those who have no clue what EMDR means, can you first of all give me the acronym meaning to the
Yeah.
audience? Because you are certified as an EMDR specialist, correct?
Yeah.
Can you tell them what EMDR stands for?
It is eye movement desensitization and reprocessing.
Okay.
Yeah. Kind of wordy.
Yeah, it's very, very wordy. I remember
Very
seeing,
wordy.
yeah. And why does it why does it differ? Now, do you think that, let's say in big T, big trauma situation, do you think EMDR? Because I've heard a lot of therapists argue that it is, but I wanted to hear your take. Do you think it's a better type of therapeutic modality to use with someone dealing with major trauma, um, than traditional talk therapy?
I think I would say it definitely can be. Yes. I lean towards the camp of yes, it's very effective. And you can look at study after study and statistic after statistic about the efficacy of it. So,
Hmm.
yes. In my experience, I've seen clients soar through it, just do wonderfully. They respond so well, and each session that we do, by the end of it, there's been a resolution of some sort.
Hmm.
And then I've had clients who just can't do it. And I
Mm.
don't know if there's still too big of a block. They're not ready to even go into a memory of the trauma yet. So I think it's different for different people.
Yeah.
But I've seen it work. It's incredible.
Gotcha. And could you give me like a quick synopsis? What does an EMDR session look like? Let's say I come in and I have, experienced, which did happen in Jamaica growing up, major violence through like
Right.
election violence. And I've seen people dead and things of that nature. I come in, I have flashbacks of that moment. What does a therapy session look like from with the EMDR specialist?
The thing about an EMDR session is it's almost a template. So just, in talk therapy, I find there's a flow and it's very organic and it, goes different directions. In
Yeah.
EMDR, you're almost following a script. It's very specific steps that you take each time. So with that said, there's an intake. I mean, first you have to get your client ready with some good coping skills in place, because they will experience some moments of intensity with this type of therapy, or they can. So it's very important to, before you even begin the treatment, make sure they know how to calm down their central nervous system, for example. Maybe give them some guided imagery and meditations that they can do on their own. It's all about grounding yourself, being able to calm yourself down.
Yeah.
After going through something intense. So that's one of the first things. And then basically you say, what are you here to work on today? What's the traumatic event? And so let's say with your example, in your youth, you witnessed a lot of violence and killing.
Right.
So you would say, is there anything earlier in your life that whatever you felt when you witnessed that, you also felt? It could be a different situation. Because what we're trying to find is either the first time you've ever felt the feelings that you felt when you went through that, or if that was just the biggest example of it. So you determine that. Then you also find out what is the negative belief you have about yourself as it is connected to that traumatic event.
Interesting.
A negative cognition, exactly. And sometimes that will be, I am not brave. I am not brave, something like that. And then we search out, well, what would you rather feel about yourself instead? And we write down a positive cognition. An example could be, I am brave and capable, for example.
So that's where the reprocessing comes in. You are reprocessing the mind to respond to the stimuli in a different way.
Precisely. You're going to be connecting when you start the therapy, you have your client either picture something in their mind about the event, or it could be a memory about the event, anything at all. They hold that in their mind and they think about their negative cognition at the same time. So I'm picturing all this street violence and killings that I witnessed, and I think, gosh, I'm just not brave. I couldn't handle it. That's when you would begin the eye movements.
Oh, what are the eye movements? What do you mean by that?
So what happens in EMDR is it mimics rapid eye movement in sleep, REM.
Okay.
If you notice, I don't know if you've ever stared at a sleeping person, but
right.
Our eyes will, when they're closed, you can see them darting back and forth.
Right.
And one of the theories or concepts there is that that's sort of our brain processing the day. Our dreams are about our brain processing what we experienced that day. So what has been found with these eye movements in EMDR therapy is it has the same effect, and you're holding on to a specific memory, and literally a clinician will take fingers and do this, and you keep your head still and your eyes follow the movements. So literally your eyes are moving back and forth while you're thinking of this memory and this negative cognition. And that's all. And you do it for, 20 eye movements or so. And the next part is the clinician simply says, what are you noticing now? And the client may say, I'm getting this picture of this toy boat that I had in my bathtub, and we just say, go with that. And you hold that picture in your mind. You do another series of eye movements. So there's no really clinician involvement as far as how are you feeling about that? What do you think about? You're just going through the movements and guiding them through. Eventually you go back to the original memory. Okay, let's go back to you were young, you witnessed violence and killing. Where's your level of disturbance as you think about that right now on a scale of 0 to 10? Our goal is to get to 0. So if they're at a 7, you keep going.
I see.
And you check in again. Oh, it's about a 3 now. Okay, keep going. So it can take a typical session can be easily 90 minutes.
Oh, wow. Wow. And it's interesting. So you mentioned earlier, traditional talk therapy when dealing with trauma can be a very extensive, long type of relationship several, sometimes 20, 30 sessions, if not more sometimes.
Yeah.
With EMDR, what have you seen? And I've heard different stories where some therapists will say they'll help people within as less as one session.
Mm-hmm.
Some say no more than 3 or 4. Is that what you found in your practice?
Absolutely. Yeah. And it depends if there's chronic trauma to get through. Clearly that can take longer, but
Yeah.
I've seen one session resolve an issue for a person. And that's the beauty of it. It's literally the brain processing something fully. It's called adaptive information processing model, because what happens when a trauma is stuck, it's maladaptive. That's where disorders come in and the addictions and all these issues. So the act of going back into the memory, reprocessing it fully to where it's not disturbing to you anymore. It's just like you're looking at a photograph and you're like, I remember that, but it's not activating me anymore.
I see. As what we like to say.
Exactly.
Gotcha.
It's now adaptive and you can just move through it. It's not triggering anymore.
That's amazing. And so one of the this is this makes me really kind of sort of excited. One of the things I went into grad school thinking I was going to come out and be an automatic therapist, and you realize no, they just throw a bunch of information at you. You come out and you find what areas you want to sort of specialize in. And EMDR is definitely something I'll be looking into. One of the questions I do like to ask about any sort of modality, and primarily because I'm a person of color, is how is it? Can any group use this? As far as any type of different ethnicity, all right? Is it applicable to a Black person, and a person of Asian descent? Does it work with any ethnic group that you've come across?
Absolutely. And I think one of the biggest reasons, now any modality should have bias out.
Right, indeed. Right.
Any therapist should check their bias at the door, right?
Yes, right.
With EMDR, I find though, there's less opportunity for the therapist to enter countertransference, for example, or bring their bias into the room, because it's really more so than other modalities that I've seen. It really is about the client working out their own healing, if you will. It's not therapist guided. It's not, let's see what this represents to you. Let's look for the meaning in this. It's just guiding the client on their own internal journey to processing something that they've gone through. So in that way, it fits with any culture.
I see. So where does one find information on EMDR? Is there a website? Is there
Yes. One of the best is simply EMDR.com, I believe. I think it's com and not org. If you just Google EMDR, it's a fantastic resource. It has it explains in greater depth than I just did what it entails, and you can see articles on the efficacy, and there are resources there and books and all these things. There's a wonderful book it's by Francine Shapiro, who is the one who developed EMDR in 1988, I believe, called Getting Past Your Past. And it's the perfect book for the client to read. Clinician could as well, but it's perfect for the client because it's almost like a self course in EMDR.
Can you repeat the name of the book?
Yeah, Getting Past Your Past. Let me I'll send you a link sometime if you're able to put up links.
I'll put it in the description below. So yeah. That's another problem.
Yeah, it's great.
Excellent. And so what I like to do, Erin, this has been really amazing to hear this information. I think that, I've studied EMDR, but I've never actually spoke to someone who actually practices it. So it's quite fascinating to hear your take on it. So thank you so much for your time on this. One of the things I like to finish off with is, how can people find you right now? I know you're in flux in terms of you move from one state to the next and your licensure and so on. Can I tell people how they can find you when that all gets sorted out?
Of course, and thank you for that. Yes, I have just moved to Missouri and I'm awaiting licensure here. It's backed up because of COVID. So because of that, I've pressed pause on all of my websites and information since I cannot work with someone until I'm licensed. When I am licensed, which hopefully will be in the next, I'm thinking month, psychologytoday.com. is a
Mm-hmm.
great resource for people to find therapists. And I am on that, which is under Erin Selover,
Mm-hmm.
Slover.
Mm-hmm.
And so that will be live again, and people can find me there if they choose to.
Gotcha. And I'll also put a link with your name there where they can punch in your name and all that good stuff. So,
Thank you.
Erin, this has been fantastic on more ways than one. I get to connect with an old friend who let me use her car all the time in college. I thank you for that. You saved me. But more so, I get to be inspired by seeing a friend pursue something that I can clearly tell she gets joy from. So that's quite amazing and really inspiring at the same time for me going into that field as well. So
Well, thank you. And that's how I feel when I see all of your posts. I just feel so happy for you that, and I think it's
yeah.
just such a good fit for you. It's such a natural extension of you. And I think that's why people are already asking you, hey, can I work with you? Because it's just who you are. So
Oh
it's,
man, I appreciate it. Yeah, I tell people, look, I can do life coaching stuff, but the clinical stuff, I can't do that right now.
you know,
And I tell them, but I think we get to connect with people like yourselves. I think it's fascinating. So, Erin, thank you so very much. I'll have information about Erin below. Also information on the books, all that good stuff that she's recommended, and also the website for EMDR as well. Erin, thank you so very much, and
thank
and
you,
stay
Steve.
well.
All right, you too.
All right,
Bye.
cheers. Bye.